Hi there, it's Derek Stenson, clinic owner and main physical therapist here at Midlands Physical Therapy. Now, I often get people asking me, what makes your clinic different from other physiotherapy clinics? And while I can't speak for other physio clinics, what I can do is speak about our core values in my clinic. So with every person that comes into my clinic, our main goal with them is to find out the true cause of the problem, so that when they go back to their favorite activity or their favorite exercise or their favorite sport or work, whatever it is they want to do, that they will be able to do so safely without the pain returning a couple of weeks later, okay? Quite often, and I think there's a common misconception out there with physiotherapy or physical therapy, that all we deal with is pain relief. But in my clinic, pain relief is only part of the process. So the main part, obviously pain relief is some of the process, but then the huge emphasis on this clinic is that your body is made stronger, it's made more resilient, your movements are made better, so that you have really good movement habits, so that when you go back to doing your favorite activities or your chosen sport or favorite thing that you love to do, that your body will not resort into its old movement habits that caused the pain in the first place. It will be able for the activity that you want to do. Okay, so one of the key things we do is aim to find the true stressor, and we aim to find this on the very first treatment. The reason we do this is because we can make out a plan for you there and then, and we can explain to you the treatment plan. Now, the treatment plan will have one or two options. You can choose which one you like best. But once you have the plan in place, you'll know exactly what is going to be done in the first 1-2 sessions, okay? Once we get that stage done, you'll know what needs to be done in the next session, what needs to be in the next session, and so on. So that you are very clear on where you are on the treatment plan. You know what you have to do that week with your rehab, and then you'll know what's going to happen when you come back in, okay? And with this process, it makes it very smooth, and it makes sure that when people go back to their chosen activity, that they are able to stay there, okay? I've been fortunate enough to learn it off some great teachers, and I've sort of tweaked it a little bit to apply it to my own clinic, okay? So I hope this makes sense. As I said, if we aim to help people who have been in pain and just cannot do the things that they love to do, so whether that be cycling, whether that play five-a-side soccer, whether that's playing with your kids, okay? If you find that you're not able to do things the way that you'd like to do them because pain or stiffness isn't getting in the way, then you are a really good candidate for getting treatment at the clinic, okay? There's plenty of options to get in touch. If you have any questions, please do. I'll be happy to answer them. I answer emails every week from people asking questions. I read them all and I reply to them all. So please feel free to get in touch, and I'll be happy to answer any questions you have.